So now we're going to move on into the Anatomy and Physiology. This is section 2. So it's page 97 through 115 in your textbook. First, we're going to kind of talk about how speech is produced. We're going to review our neuroanatomy that you've learned in your previous anatomy section. And then we'll really go over cranial nerves and then the different anatomy for the speech structures. So the first thing to look at, this should look pretty familiar to you, is how oral communication occurs, right? So we have the nervous system that sends all of the signals to the different areas, and then we really have to break down what speech is or what communication is, right? So we've talked about cognition and language and how cognition kind of overrides our language to tell us the information about our environment, right? And then our language is really our ability to give or receive information to or from another person. And then we have hearing that kind of aids in that, and we'll talk about that towards the end of the course. But what we're really going to get into now is the articulatory, the phonatory, resonating, and respiratory structures. All of those structures share structures with the swallowing, and so we'll also talk about swallowing towards the end of this. So in this lecture, we're going to really focus in on just a newer part of the cranial nervous or central nervous system. We'll add some information on the peripheral nervous system and then go over those articulation, phonation, resonation, respiration, and swallowing. So when we break it down into the pieces and parts and the roles of each area, we can really see how it works, right? So from the very beginning, we have the brain sending signals to the body, and that's either from the central nervous system or the peripheral nervous system, right? And then a part of that is also cognition. And then we have the respiratory system, where air is brought into the lungs through the nose, the mouth, the pharynx, the larynx, and the trachea, and then that air flows out from the lungs through the trachea and the larynx, right? So it's just our inhalation, exhalation, flow of air, just to provide that volume that we're going to need for our voice. So in order for the phonation or the voicing to happen, our vocal folds have to close, and then as part of our respiratory system, that air flows and pushes through the closed vocal cords, vibrating those vocal cords and then creating a sound. So the vocal cords are actually kind of a passive mechanism in voice, in that once the muscles have pulled the vocal cords closed, it's really airflow and pressure that creates the voice. And then as sound bounces around our pharyngeal, laryngeal, and nasal cavities, we have resonation. So we have phonation, that's just the sound coming through the vocal folds, and then resonation is that sound bouncing around all of the cavities. So it's really our amplifier or our megaphone. And then we finally have the lips, the teeth, the tongue, and the palate articulating or shaping that sound into speech. And so that's our articulatory system, right? And so we have the sound from the vocal cords, it flows through our resonators, and then we shape those sounds into speech using the articulators. And then, of course, once we start producing those sounds, we have to give our rules and meaning, and that's where language comes in. So that's really kind of the hierarchy of communication and speech production. It's lots of little pieces and parts working together to give us what we have to have. And then on top of that, we have hearing that really allows us to not only hear the speaker, right, when we're listening to somebody, but also gives us feedback to tell us when our system has made an error. All right, so in order to break that down even further, we have to look at the neuroanatomy. So where do all of these signals come from? Because we know, just like with language, even if all of our structures are intact, so we have a mouth, we have a tongue, we have all of our teeth, there can still be problems with speech, either with voicing, with breathing, with articulation, and we have to figure out where those errors are coming from, and a lot of times it can come from our central or peripheral nervous system. So there's not a whole lot of new information for the central nervous system. You still need to know the lobes of the cerebrum, right? And the somatosensory cortex and the motor cortex are very important when it comes to speech. Also, the cerebellum is very important, right, because it coordinates those fine motor movements. And then we have the brainstem that not only holds our cranial nerves, it also allows that information to flow from the central nervous system and the peripheral nervous system. The information that we're going to add that's new here is just the pyramidal and extrapyramidal pathways. So the pyramidal originate in the motor cortex and then they travel to the brainstem, but the extrapyramidal pathways are within the cerebrum, just kind of all over the place. So let's look at the actual function of the pyramidal and extrapyramidal. So the pyramidal system is a direct system, meaning that it goes from one place to the other, right? It doesn't have a whole lot of stops along the way, and it carries impulses for voluntary movements. If there's an injury to the pyramidal system, then you can have paralysis of the larynx, the pharynx, the soft palate, the tongue, the lips, or the face. So think about those structures and the systems that we just went through, right? At what point is the larynx important? At what point is the pharynx important? Or thinking about our soft palate, our tongue, and our lips, just for articulation and how important those are to be understood, or to produce the correct sounds, or to swallow. And then we have the extrapyramidal system, which is an indirect system, and it carries motor impulses from the brain to various muscles via several relay systems. So it's the one that has some stops along the way, right? We're going to have members kind of get off of the bus along the way, and then it's going to keep going to where it needs to go. A part of that system is the basal ganglia, so it's a major structure of the extrapyramidal pathway, and it helps program movement patterns and maintain muscle tone and posture. So if there's a problem with the basal ganglia, then patients can present with Parkinson's disease. And this is again important for speech because Parkinson's disease has a very distinct speech qualities. So when we go into our motor speech disorders, this is the system that's kind of most important that we have to look at and remember. Alright, so now we're going to move on to the peripheral nervous system, and this is again a little bit of review, but we're going to add additional information to it. So the three main parts of the peripheral nervous system are the cranial nerves, the spinal nerves, and then the autonomic system, right? We're not going to go any further into the autonomic system other than we have the sympathetic and parasympathetic. We're not going to go any further into the spinal nerves other than to know that it supplies information to the small and large muscles throughout the body. And then it also controls automatic functions, so that could be breathing, and think about how breathing is important for our voice and for our speech. But what we're really going to add on to is the cranial nerves. So the cranial nerves connect to the various sense organs and the muscles of the head and neck, right? And that's really where speech comes into, as well as swallowing. So there are 12 cranial nerves, and they send sensory signals to the brain and motor signals to the muscles of the face, the mouth, the tongue, the palate, the eyes, and the neck. And it also has sensory signals for hearing and balance. So remember, we have sensory signals that are afferent and motor signals that are efferent. We want to keep using that as we go through our course. And what you see over here on the right is just a healthy brain. It's been flipped over, and right here at the bottom you have the brain stem. Okay, at the very top you can see these two white areas. That's a cranial nerve. You come a little bit further, you have two more white areas. Those are additional cranial nerves. And then if you go down the brain stem here in the middle of the brain, branching off in these lighter areas are all cranial nerves. So if we kind of peel that away, let it make more sense, you can see we have how the nerves lay out as you go down the brain stem. And so the cranial nerves are numbered and according to where they exit the brain. So the ones that we're going to focus on are the ones just specifically for speech. So it's good to know that there are 12 cranial nerves. We're only going to focus on 7 of them. Alright, so you'll see over here we have our 7 cranial nerves. We have 5, 7, 8, 9, 10, 11, and 12. Cranial nerve 5 is the trigeminal nerve, and it provides sensory and motor signals to the face and the jaw. So it's the one that has sensation and motor signals for lifting the forehead or feeling the forehead. It has a role in the eyes, the nose, the upper lip, the jaw, the tongue, and the cheeks. The facial nerve is also a sensory motor nerve, and it's responsible for taste. It's also responsible for movements of the forehead, closure of the mouth, retraction of the corners of the mouth, and cheek movement. So this is the nerve that helps you purse your lips as well as smile or move your lips side to side. And if there's damage to this, then you can have kind of a mask-like appearance, meaning that you don't smile very much, and when you talk, the lips don't move. Alright, so now we're going to move on to anatomy of the moving parts. So I'm going to break this down into the respiratory, phonatory, resonating, and articulatory systems. But essentially just remember that all of these things work together, okay? But when we're talking about these systems in future lectures, we're going to try and isolate each one of those, because that's kind of how we do it in clinic as well, is isolating where the breakdown is. So when we're looking at how it all works together, right, I keep saying over and over again, respiration, phonation, resonation, articulation. If you watch this video, you can see we have air coming from the bottom underneath the vocal cords. It's going to flow through the vocal cords. You'll see the tongue move, and then you'll see the back of the mouth move, and that's that where it says uvula. You'll see that kind of bow up and touch the back of the throat. So let's watch this again. You can see that air come out and the tongue is moving. And so that air coming through is our respiration. The vocal folds closing is our phonation. The resonation has to do with the uvula area here in the back, as well as just resonating or bouncing around all of the structures in the throat and the mouth. And then our articulation is that movement of the tongue, right? You see how it touches the back of the mouth. It also touches the front of the mouth. It goes in between the teeth. All of that is articulation. So starting with respiration, we have kind of what the respiration does. So respiration is important for not only breathing, right? We need to have oxygen, but it also provides coordination for our voice and for our swallowing. So when we're voicing, it provides that steady flow of air through the vocal cords, so we have a nice voice quality, and it also coordinates so that we're not taking breaths in the middle of sentences or talking and running out of air too often. During swallowing, it also modifies to stop during exhalation typically, so that the vocal folds close, the airway closes, and food can go past the airway into the food pipe easily and safely. Okay, so when we're looking at the structure of respiration, we have 12 pairs of ribs that form a cylinder-like structure, and they're really the primary support for resonation. Just like all bones, it's there for support. It doesn't have a huge function. And then we have the intercostal muscles that attach between the ribs and help move the ribs for respiration. The diaphragm is the floor of the thoracic cavity, and it's a large muscle that expands across the thoracic cavity, and it's really kind of the driving force of respiration. So what you'll see is here at the bottom we have the diaphragm that expands across, and it'll pull down, expanding the rib cage or expanding the thoracic cavity, and then the intercostal muscles expand the rib cage, and that provides a pressure so that it can draw air through the mouth, through the trachea, into the lungs, and provide that inhalation. And then as the diaphragm collapses, the intercostals collapse, it changes the pressure again, and that air is forced out through the trachea and through the mouth. And so you'll see when we have the lungs, the mouth, the nose, the pharynx, the larynx, and the trachea, they don't necessarily have so much of a driving role, other than they are space for air to travel through or to be stored and then to pass through as it exits. For phonatory anatomy, we have to look at it kind of in multiple ways. And so ultimately we have, for phonation, voicing, right? Phonation is the sound that our vocal folds produce, and so we're going to learn it from that perspective in our voice lecture. We're also going to learn it from a swallowing perspective. So it's the same anatomy, the only difference is how it functions. So ultimately, the most important thing for phonation is the larynx. And so it's otherwise known as the voice box. It houses the vocal cords, and you'll see over here on the left, you can't see the vocal cords very well, but we'll take a look at those in class during the voice lecture. But they're bands of tissue that sit inside the larynx and provide us voice. They're also a protective mechanism during swallowing. The space between the vocal folds is known as the glottis, and so you'll see that in other things, and it's essentially just a space. It's not an actual structure, it's just that opening between the vocal cords. I put this here so that you are aware that the glottis is the opening between the vocal cords, but it is different from the epiglottis, which is different from the subglottis and different from the supraglottis. Okay? So when we're looking at our picture, I have highlighted the larynx, and it's this entire structure here in orange. So at the very top, the top of the larynx is the epiglottis. It sits on the back of the tongue and gives us a little cup-like shape. Okay, that cup is very important for swallowing. It's known as the vallecula, and it catches things as it's spilling from the back of the mouth into the throat so that it doesn't spill into the airway. So the epiglottis is the structure, the cup-like space is the vallecula. Underneath the epiglottis, if you kind of follow it down, you can see the cartilage that surrounds the larynx, right? That's kind of in that lighter color there. And it just kind of, cartilage just holds things. It's again kind of like bones, it's just structural support. And then the muscles attached to the cartilage. Within the cartilage are the vocal cords. So if you think about supraglottic, supra means above, and subglottis, sub means below. So supraglottis is just the area above the vocal cords up to the epiglottis. Subglottis is the area below the vocal cords to the trachea. That's all that means. So we'll move on and get a little bit more specific with the muscles, but just know for now these are kind of the main areas for phonation. And we'll go more specifically into those different anatomical structures during our voice lecture. So when we're talking about the muscles of the larynx, there are extrinsic and intrinsic laryngeal muscles. Speech pathology really only focuses on intrinsic laryngeal muscles because there are so many extrinsic laryngeal muscles and they're very, very small. We don't quite understand all of their functions, but we do understand intrinsic laryngeal muscles, and we know that they're very, very important for speech and swallowing. And so this is another picture of the larynx. So up here at the top you'll see these two little horns at the very top. That is the hyoid bone. And then as it reaches around, you can see all of these bands of tissue. Those are muscle. In the red you have the thyroid cartilage. Underneath that you have more muscle. And then in the yellow you have the cricoid cartilage. And underneath that in the gray with the rings are the trachea. And what you're seeing as the rings are the tracheal rings. So that's the front of the larynx. On the back side of that, you can actually see the epiglottis in green. And then you'll see the thyroid again from the inside. So this is kind of a larynx cut in half, so you can see inside of it. In blue, you have the arytenoid cartilage, and that's where the vocal cords attach, and the arytenoids move from the outside inside. So if you put lace your fingers together and your thumbs are sticking up, imagine your thumbs are the arytenoid cartilages, and you can move them towards each other and away from each other, right? That's how the arytenoid cartilage works. And then again in yellow, you have the cricoid cartilage. So this is important for muscles because the muscles attach to the cartilage, and you get the names of the muscles based on where they insert and attach to for the cartilage. So for example, we have the insertion of the cricoid, or the muscle inserts at the cricoid and attaches to the thyroid, which gives us the cricothyroid muscle, right? And we'll look at this again further in detail in class to help that make sense. So another example, if we break it down, is the thyroid, or the muscle attaching to, or inserting at the thyroid and attaching to the arytenoid, and that gives us the thyroarytenoid muscle. Okay, that's also known as the vocal folds. And then if we go the opposite direction, we have the cricoarytenoid muscle, which means that it inserts at the cricoid and attaches to the arytenoid. Alright, so now we're going to move on to our resonating anatomy. And these are all structures that you've heard of before, except we're going to add the velum and the soft palate to it, and you'll see it again when we talk about articulation. So let's kind of review where we are so far. We had respiration, where that air is flowing in and out of our lungs freely. And then we have phonation, where the sound is produced, right? The vocal folds pull together within the larynx, and that air is forced through the vocal folds to give us sound as it vibrates. And now that sound has to bounce around inside the resonating cavities. So if we're looking at this picture over here on the right, we have down here the vocal cords, which we just talked about, which tells us that this area in the front is the larynx, right? And you see this little flap at the back of the tongue, that's the epiglottis. And then you see this curved area just above the vocal cords or the glottis, and that's just the arytenoids that they over-exaggerated in this picture. Okay, so if we have the glottis here where it's come together and the air is flowing through, that air, that sound now is going to bounce around all of the cavities above it. So as that sound flows through the glottis, it's going to hit the larynx on the inside, right, our supraglottic area, and then it's going to hit the back of the tongue through the pharynx. And then depending on the sound that we're making, it's going to travel through the oral cavity. But if we're making an or an n sound, an m or an n sound, it's going to travel through the nasal cavity. And that gives us our resonators, okay? What stops the flow of sound through the nasal cavity is a muscle within the velum. So on the back of the oral cavity here, you have this little area hanging down that you know automatically is the uvula, right? Everybody's seen their uvula. There's a muscle that attaches to the back of that rises if we don't want air to go through the nasal cavity or sound to go through the nasal cavity. And that's housed within the velum. Okay, the velum is just a fancy word for soft palate, and we're going to use velum for the rest of class. Alright, so now we're going to move on to articulatory anatomy. This is the same picture that you just saw. So all we're adding on to this is the mandible, the maxilla, the lips, the teeth, the hard palate, and the tongue. Right? So think about with resonation, we're looking at the overall space. Articulation, we're looking at the structures, because the structures are what's going to shape the sound. So if I say ah, I just have sound bouncing around within my throat and within my mouth. But if I say ah, ta, 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 I'm now shaping that sound using my articulators. So for the maxilla and the mandible, the maxilla is the upper jaw, and it makes up the major portion of the hard palate. And then we have the mandible, that's the lower jaw, that forms the floor of the mouth. So you see here in red, the maxilla is this very large structure on the front of the face. It houses the top or upper teeth, and then the mandible here at the bottom houses the lower teeth and forms the floor of the mouth with muscles and tissue. And it also has this hinge over here on the side to help us open and close our mouth. We have the lips and the cheeks. So the lips have a primary muscle known as the orbicularis oris, and it's really a circular muscle that goes around the lips, and it helps us, if you purse your lips, you're squeezing your orbicularis oris together. The lips also connect to several muscles within the chin and the cheeks. And so for the primary muscle of the cheeks, we have the buccinators. They're just a large flat muscle of the cheek, and you'll see it over here on the side. Going sideways from the orbicularis oris is the buccinator. If you smile, you're using your buccinator muscles. So the lip muscles, the chin muscles, and the cheek muscles have to work together to give us lip movements. It's not just that orbicularis oris, but the orbicularis oris is very important. And then behind the teeth, or behind the lips, we have the teeth. And so again, the upper teeth attached to the maxilla, the lower teeth attached to the mandible. When we're talking about teeth, we talk about not only if a person has all of their teeth, but how their teeth line up. And how the teeth line up is known as the occlusion. So a normal occlusion is here. If you look at the picture A, we have the back molars lining up very nicely, and that gives us just a slight overlap of the front teeth, but overall everything's kind of lining up. We have a class 1 malocclusion, and that's where we have an offset of the upper molar, which gives us a slight overbite. And then you have a class 2 malocclusion, where we have even more forward movement of the back molars lining up with the bottom molars, giving us a greater overbite. And then finally we have where the back molar is moved forward and the top molar is back in that lining up, and that gives us an underbite or a class 3 malocclusion. So when you're looking at these pictures and you're thinking about teeth, think about how shapes can be affected, or sounds can be affected by whether the teeth are there or not. And then also think about when you're chewing. So if you have a very significant overbite or underbite, how difficult it can be to break down a piece of steak. Right, now we're going to move on to the hard and the soft palate. So the hard palate is the area, if you touch your tongue to the roof of your mouth, it's everything that's hard. So just behind your teeth, all the way to where it starts to get squishy in the back of your mouth, is the hard palate. And it can also be broken down even further to where you have a very bumpy area or ridges on the front just behind your teeth. That's known as the alveolar ridge, and that's going to be important when we talk about different speech sounds. And just behind that, that smooth area is really where we classify the hard palate as far as articulation goes. The hard palate and alveolar ridge are adynamic, meaning that they don't move. The tongue just goes to touch it. It's not going to go anywhere. If it's there, it's there. If it's not, it's not. The soft palate, or the velum, if you touch your tongue to the roof of your mouth, is that squishy area in the back. And it's a dynamic muscle, meaning that it moves and touches the tongue. It also moves and touches the back of the throat. All right, and then we have the tongue. So we're going to divide the tongue into 3 different parts. We have the tip, or the apex, the body, and the root. So when we're looking at the tongue here, you can see the mandible in yellow. Just above that, you have the mylohyoid, which is a muscle, the geniohyoid, another muscle, and then the genioglossus. The genioglossus is really kind of the larger area, that fanning out muscle that you see on the bottom of the tongue, and it works together with the transverse and longitudinal muscle. On the back, you have the lingual tonsil, and that's just kind of an area on the back of the tongue that attaches to the tonsils on the side of the throat. So when we're looking at this, the tip, or the apex, is the thinnest or most flexible part. So if you grab your tongue in the very, very front, you can feel that thinner area. That's the apex. Just behind that, you have the body, and the body is divided into 2 parts. At the front of it, you have the blade, and that's the portion of the tongue that lies just below the alveolar ridge at rest. So if you press your tongue to the roof of your mouth, you'll kind of feel that bumpy area again. And that area of the tongue that touches that is the blade. Just behind that, where you have the smooth portion of your hard palate as well as the soft palate, gives you the rest of the body, also known as the dorsum. And then the back of the tongue, the very, very back that attaches to the epiglottis, is known as the root. It's also called the base of tongue. And then this is a picture you can look at just from the front, all of the different parts in the articulators. So here at the very top, we have the frenum, and that's just a very thin band of tissue that attaches from your gums to your lip. Then you have the teeth, obviously. And then just behind the teeth, you have the hard palate, and remember that very front portion that has a bunch of bumps and ridges is the alveolar ridge, and just behind that is just the rest of the hard palate. And then after that, you have the soft palate, which is that squishy soft area at the top, and then hanging from that is the uvula. On either side of the back of the mouth, you have the tonsils. These are called the palatine tonsils. Just in front of the tonsils, you can see that arch is formed that attaches to the uvula. That's known as the fascial pillars. And then you have the tongue, and the tongue is attached to the floor of the mouth by another frenum. So you have the labial frenum up at the top that attaches to the lips, or the labia. And then you have the frenum that attaches the tongue to the floor of the mouth. That's the lingual frenum that attaches the lingua to the floor of the mouth.